Welcome back. Heart disease is the #1 killer of women, and that's why last week our series 20 Hearts on 20 explored the risks of heart disease as 20 local women learn more about their own heart health.
Tonight we bring you part 2 of 20 Hearts on 20, the reactions from the women after receiving the results. TV 20's Emily Burris shows us what some of them were motivated to do.
Last week, we introduced you to 20 women willing to publicly reveal a snapshot of their heart health. For some women, the results were affirmation. For others, they were a wake-up call.
So we're going to go over your assessment.
20 women agreed to go public with their heart health by sharing the information of a comprehensive risk assessment taken at North Florida Regional Medical Center.
About what number should that be?
You want it less than 200.
So let's take a look at their results. Our 20 volunteers ranged in age from their 20s to their 60s. All 20 women had at least one risk factor for heart disease. The majority had 3 or more. Almost all had factors that cannot be controlled, like age or family history, but some of the most common risk factors that can be controlled were high cholesterol, an elevated BMI, and little to no exercise.
So you're below average at risk for heart disease.
For younger women, like 32-year-old Mary Foster, learning about changes to help lower cholesterol could help prevent bigger problems down the road.
And it doesn't really require this drastic lifestyle change that's going to somehow impact on my overall happiness. I mean, it's a very simple change that can help me in the long term, which is really what's important.
In some cases, the test revealed new information. At 24 years old and very healthy, unusually high cholesterol led Megan Wilhelmsen to discover she had unknown family history.
I spoke with my mom and dad and actually realized it was genetic. So it's interesting to learn. I know I exercise daily, that sometimes there are things that you can't change, but there are things that you can modify to make yourself healthier.
Others, like 41-year-old Jeanette Colon, were surprised to learn even moderate exercise could reduce multiple risk factors.
I want to see my kids graduate college. I want to see my daughter get married. So 3 times a week in a gym, it's nothing.
And it was reassurance to volunteers like Chastity Jones and Ashante Simmons, who through diet and exercise are seeing more results than just numbers on a scale.
But you can see the change on the outside, but you don't really know what's going on the inside.
For those who were high risk, their results served as extra motivation to turn over a new healthy leaf.
I needed a good jumping off point to make changes. It's definitely time to make some changes.
You got all this information and it's like, what are we going to really do with it?
Ultimately, knowing where you stand with tests like these could save your life.
Starting at age 20, about every 4 to 6 years, they should be assessed for their 10-year risk of having a heart attack or stroke. Based on that percent of risk, we can then identify those patients that are high risk and need to be treated.
Much easier than reacting to a deadly heart attack or stroke.
I gotta make this a lifestyle. Gotta make it a lifestyle.
For more information about the risks for heart disease and ways to monitor your own heart health, you can visit our website, WCJB.com. Emily Burris, TV 20 News.